We have a program here at Henry Ford to help manage the frequently presenting patients. And as part of one of the people who are on this committee, we see that these patients can elicit a lot of negative reactions from our own physicians. So the purpose of our survey was to see if other physicians in other ERs across the country have the same reaction towards frequent patients. The findings of our study were that 97% of emergency physicians across the country are seeing frequently presenting patients. And 91% of these physicians stated that frequent patients are a problem for an ED. We didn't want the study to be physicians don't have empathy for their patients, but in fact all of our comments that we got back, physicians really understand what's going on, and it's difficult because an emergency room physician shouldn't be the person who cures homelessness. The emergency room physician shouldn't be the one that strategizes about transportation for patients. The emergency room is not the place where cost of medications should be figured out. And so the emergency room physicians are feeling burnout because they're having to deal with all of these social issues. So the empathy issue, it's not that our physicians lack empathy, but what I would say is our physicians have empathy, but they really don't have a chance to help the patients the way they want. I think the take-home message for hospitals, and especially for emergency room administration, is that emergency room physicians are in the trenches dealing with these frequent patients. They need assistance to do this. 70% of our physicians stated they want a program to help them help this group of patients.